We are a comprehensive program that can tackle any issue related to sleep. Many people think that we're the place children go for sleep studies or CPAP machines, which is true, but newer programs such as ours are situated to be able to diagnose and treat any issue, whether it's respiratory, behavioral, or neurologic, and at any age from infancy to adulthood. Our patients usually get evaluated by me, the program director, either in person or via video. I've got experience in cross-training in sleep medicine, sleep psychology, pediatric pulmonary, and general pediatrics. If needed, we can perform sleep testing such as diagnostic polysomnography, titration studies, or even multiple sleep latency testing, otherwise known as MSLT, the test for narcolepsy. If there's a concern a child won't tolerate testing, we can provide special accommodations or a desensitization plan. Sleep disorders have many different treatments. We can administer a behavioral plan, nutritional plan, prescribe medication, or use assistive breathing devices such as CPAP or supplemental oxygen. Depending on the case, we garner the assistance of various other pediatric specialists, including otolaryngology, or ENT, endocrinology, neurology, psychiatry, urology, dentistry, genetics, and developmental pediatrics. And while we have a lot of fancy specialists and a state-of-the-art sleep laboratory with pediatric-trained technicians, the core of the program is the comprehensive evaluation and personalized treatment. There's no one-size-fits-all. Everyone has their own circumstances, family situation, values, and goals. I work to meet the families where they are. This is especially important in children with developmental disabilities or chronic medical conditions. I sit down with the child and family and figure out what different factors are in play. I provide a lot of education and participate in shared decision-making with them to arrive at a holistic, multimodal diagnostic and treatment plan. Most commonly, children come to us because they are having trouble sleeping, or they're feeling tired or having trouble focusing during the day. Of course, there are many different causes of these symptoms, and we evaluate for all of these. Sometimes we even find more than one cause. Obstructive sleep apnea is the most common condition that we see. Sometimes the child presents with clear snoring or difficulty breathing in their sleep, and sometimes the diagnosis is more subtle and surprising to the parents. We also deal with central sleep apnea and sleep-related hypoxemia or hypoventilation in some patients. Insomnia is a very common problem, whether it's purely behavioral or if it's combined with other medical or sleep conditions. We can treat it with sleep training, sleep hygiene, advanced behavioral techniques, motivational interviewing, medication, and even cognitive behavioral therapy for insomnia. Nowadays, we're seeing a lot of circadian rhythm disorders, such as delayed sleep phase syndrome. Children are staying up all hours of the night, and then they're unable to wake up in the morning, or they're dozing off throughout their classes. Some children are severely sleepy and may not even have an obvious cause, even after being evaluated at other sleep medicine programs. We are uniquely positioned as an academic, tertiary care program to evaluate these cases, to perform multiple sleep latency testing, and diagnose hypersomnia and narcolepsy. Many of these children would otherwise grow up and typically go over 10 years and 3 other specialty referrals without receiving a proper diagnosis. Other common neurologic conditions we see include restless limb syndrome and parasomnias. Night terrors, nightmares, sleepwalking, periodic limb movements, hypnagogic hallucinations, sleep paralysis, and cataplexy are other conditions we see. Everyone knows that enlarged tonsils and adenoids, or sometimes allergies or acid reflux, are major risk factors for obstructive sleep apnea. We can often use medications or even behavioral treatments for these, and half the time can avoid surgery, though certainly the more severe cases will benefit greatly from surgery. Most neuromuscular conditions genetic syndromes, and skeletal dysplasias have high risk for sleep apnea. They have hypotonia, weakness of the muscles in the tongue, in the palate, and the throat, and even decreased bony passages or small mandibles, all different reasons for causing obstruction to the flow of air when they're sleeping. These patients usually require treatment with a CPAP mask and machine, and they receive a large boost to growth and development from this treatment. And I would say that the fastest rising risk factor in the last decade or two has been obesity. Up to 60% of obese children have obstructive sleep apnea. We have developed a childhood obesity program, the Healthy Lifestyle Clinic, with specialists in nutrition, cardiology, endocrine, GI, and even bariatric surgery in order to help get them cured. Many of them need CPAP therapy, and I work with them personally on this intensively in order to achieve improvements in their academic performance by allowing them to breathe and increasing their oxygen levels and sleep quality. There are a lot of medical problems that can often be traced back to sleep. Many cases of ADHD are exacerbated or caused by poor sleep. Very commonly, sleep apnea, restless leg syndrome, or behavioral insomnia. Headaches can be caused by insufficient sleep, an inconsistent sleep schedule or low oxygen levels, and sleep disruption from sleep apnea. And enuresis or bedwetting is often caused by obstructive sleep apnea. Adrenaline surges during pauses in breathing make the body produce large amounts of urine during sleep, and those same adrenaline surges then compel the bladder to contract. How does that sound?